Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you are just joining us, ExpressCare's Dr. Jitka Lom is joining us in studio to tell us a little bit about some medical how-tos. Before the break, we were talking about how to take medicine properly, but now we wanted to talk a little bit about ointments and creams, as well as inhalers. So let's talk with the ointments and creams.
Sure.
A lot of people, I'll admit I'm one of them. I don't really read the label.
Sure.
I just
put it on.
Slap that stuff on.
Yeah, so it's really important. So I've brought Lotrimin, which a lot of people might buy over the counter for their ringworm. So let's say you're in the gym and you got a little ringworm. So I've created a little ringworm on myself here with a marker. And I want to just show you, because when you're putting the medicine on, you put a little dab like this. And there are people who just sort of go like this and then that's it. No, you need to rub it in, okay? You need to rub it in, and you need to rub it in wide. So my little ringworm is this big, but for ringworm, you need to rub it in wide, wide, wide. The reason is because the fungus tends to spread at the border of the rash. So if you rub it in widely, you're gonna cover it, okay? And then it won't sort of keep spreading further and further. The other thing about ringworm is you have to be really patient and do it twice a day for a minimum of 3 weeks. Otherwise, it will come back. So that's one skin problem that you have to really just continue, even though most of the rash is gone. Just keep going till you get rid of it entirely. If this were a spot that isn't ringworm, for example, an eczema spot or a psoriasis spot, the treatment is different, because this would be, let's say, a steroid ointment, which would, let's say you'd see hydrocortisone ointment on it, which is kind of greasy. This is white, so that's a cream. So if you had a steroid ointment and this was your psoriasis or eczema patch, you would only put it on that little spot. Again, you just put it right on the dot and rub it in hard till you don't see any more of it. Okay, you don't want to put it like icing on a cake. You want to rub it right in so you don't see. So you don't have to wipe it off. You just leave it on there, and make sure you do it twice a day. So the studies show that when people are prescribed ointments or creams, they tend to forget. They tend to not use it. They use it, if it's supposed to be twice a day, they use it once every other day. They're not consistent. So if you want to get well, just remember, you're already spending money on this medicine. Use it correctly. Put it on your phone app so that you can be reminded. All of us are busy, but that'll help you stay on track and get well soon.
Okay, so the creams, make sure you put all the way around on a ringworm, and then with the ointments for psoriasis and eczema, just specific to this targeted area.
Right.
Okay, and now I know you've got some other gadgets here. Let's talk about how to properly use inhalers, and then whatever that other gadget is that you have there that I'm not familiar with.
Sure. So many people on Ireland have asthma, and sometimes they'll use a nebulizer machine at home. That costs about $30 to $50 plus the little stuff that goes in there, and the albuterol medicine, and it's kind of a hassle because you've got a mask and all that, and you can't carry it with you. So it's much easier to get a pump, and this is an albuterol pump that you can use, and many people use this incorrectly. They go like this and then squirt it. When you do that, you're coating your tongue and the inside of your mouth and your lips. You're not getting the medicine inside. So I'm going to show you how to do this properly, where you basically blow all the way out, then you squirt, and you inhale it all the way in. And if it makes you cough and you feel that tickle all the way down into your lungs, then you've done great. And you shouldn't taste too much on your tongue. So you notice I was holding it outside of my mouth about an inch or two away. That way there was a spray, a mist that I was able to inhale all the way into my lungs. Now you can do even better than that, because there's a bit of coordination involved there that's a little tricky, especially for young people like children and so on. This thing costs about $45 to $50, and it's got about 100 pumps in it. So it's about 50 cents a squirt. And you'd be using 2 squirts, twice, 3 times a day, something like that. So you don't want to waste this medicine. Same with that albuterol nebulizer that people have, and it's bubbling and the mist is going in the air. And so you can really save money if you pick up something like this called a spacer device, which you plug your albuterol in over here, then you squirt it. Now you've got a mist in here, and all you have to do is
inhale it,
blow in and out. Okay, so this costs about maybe $20 at the pharmacy, and you can plug in any inhaler into it. And if this is, if you want to make a homemade one, you can take an old shampoo bottle and cut a hole in the back of it, and you can create your own. So, you know, it's very cheap and very easy. That way you get all of the mist into your body and you won't need as many sprays. So when you do one spray, you would inhale 4 or 5 times, take a little break for about 10 minutes, see how you feel, then do a second spray. So if you need it. So that way you're not going to need as much medication, you'll save money in the long run.
Okay, so definitely more cost effective.
Yes.
Okay, and then you were mentioning about the nebulizer, and I'm interested in that because I have a 2-year-old, and oftentimes when he gets sick, he needs that nebulizer.
Right.
And it really is hard to sit there and try to have a feisty 2-year-old that's already cranky,
yes,
sitting there putting his mouth on the nebulizer. So what's the best remedy for that?
Yeah, so there's a couple of options. When you have the nebulizer, this is a little bit age dependent and depending on the kid too. But you can have the mask that covers the face and just put it on the child, and they're usually yelling and screaming, which isn't bad because when they're inhaling, they're taking big breaths of the medicine, okay? But still it's going into the air and so on. If it's a little bit older child, that you don't have to use a mask, you can use a little attachment that goes into the mouth, okay? And then it's a little easier and they're inhaling better. But this spacer device also comes with a mask for young children. So you can just basically put it on their face, squirt, and the child goes and they inhale it in. Okay. So it's actually just as good. And the studies show, you know, even though you have a machine and a nebulizer and all that, the amount and the efficacy of the medicine is exactly the same whether you're using a little spray thing, canister, or whether you're using the machine nebulizer. So both are effective. This is a lot easier and portable and usually cheaper.
Okay, so we've covered a range of topics today, Doc. This has been really, really informative. Just any last words as far as properly storing all of these things?
Yes.
That's probably another big thing, especially with Guam's heat, people turning their air off.
Yes, and I did mention the car, I think, earlier. A lot of people will leave medicines in the car. That's usually a really bad idea for liquids and capsules because it'll melt. But the other thing about storage is many people have a medicine cabinet in their bathroom. It does tend to get very warm and moist in the bathroom, and that isn't really the best thing for your medicine. So an ideal place would be maybe in your bedroom or kitchen, someplace that's a little bit less moist. Cool and dry.
Good to know. Well, thanks, Doc,
You're welcome.
as always, for all the great information. Dr. Lom will join us again next week, where we will be talking about matters of the heart. We will specifically be talking about heart attack symptoms and prevention. So make sure to stay tuned for that. We will be back to wrap up the show right after this. Stay with us.